You have been willing to say stark things, including in terms that other people would be likely to sugarcoat, and you lay it out bluntly. What do you think is the reality check that Americans need about safety considerations and the realistic chances of opening in-person instruction for kids this year?
Well, there's several things. First of all, it's not zero risk, even in communities where the transmission of COVID-19 is relatively low. Opening schools is not a zero risk exercise. You don't know what the scale of the risk is unless you've done your baseline testing. You know exactly what percentage of your kids in each school level, each age group, are already infected. What percentage of your teachers, your cafeteria workers, your janitorial staff, and your administrators are infected, and you track them over time in cohorts so that you follow infection rates, and you have baseline data and building data, and then you have policies in place for what to do if someone is infected, and you have people who can track them and figure out if they took virus home to their grandmother, to their father, to whomever. None of this is being done in almost any school district in America. And on top of that, the costs. How do you make a school safe to attend for everybody involved? The adults, the children, the visiting parents. How do you make a school safe to attend? It costs money. You have to have a good air conditioning and airflow system. You have to limit the number of people per classroom, which means more space needs to be somehow available, or staggered schedules with more teachers handling fewer students. All of these things need to be done, and they can't be done in school districts where there has never been enough money to do basic education at any time in the last many decades. So we're asking schools that have zero spare cash to somehow build a fancy air filtration system, to somehow do testing and somehow create additional classrooms. They don't have money.